Hello YouTube. I had weight loss surgery. One of the things that was very helpful for me was all these videos that people post online. Thank you for those that take the time to do so. So I thought today I would take time and share with you about my experience in Tijuana. Although this video will be a little different, I'm going to cut right to the chase and just give you the things that were kind of to cut through the chaos of everything that's happening down there. So here it goes. Let's talk about hospitals first. In Tijuana there are 3 hospitals. The 3 hospitals are this. The Hospital MI, the MI hospital. This would be considered probably the lowest end of the hospitals. It's located in business district in Tijuana, and reviews on it and things like that are pretty poor. The next one, which is kind of the middle of the road hospital, would be considered the Florence Hospital. This is the one I actually went to and had my surgery done at. Florence Hospital is nice. Compared to a US hospital, you would probably find this hospital in a small town. Small town hospital, the technology isn't quite up to what you would expect now if you were to go off to Minneapolis or something like that, but it is definitely still a nice hospital to go to. The next hospital after that though is the Oasis Hospital. Now this is the brand new hospital in Tijuana, and it is pretty state-of-the-art. It is up there right on par with the US hospitals that you'll find. I do want to explain down there is how the doctors work with these hospitals. Each doctor down there, for the most part, has what's called privileges. They have the choice of working at whichever hospital that they choose. So, for example, I had my surgery done with Dr. Ramos Kelly. Now, Dr. Ramos Kelly has privileges at all 3 hospitals. He could have chose to have my surgery at either one of the 3. As a matter of fact, he gave me the option to do so. There's a different price difference to it. The hospitals in Tijuana do their billing a little bit differently. Here in the US, if you go to a hospital, you check in and the hospital bills you for all your care and then pays the doctor for their time. Well, when you're going down for weight loss surgery, you're getting a package price. So what's happening is I'm physically paying the doctor, then the doctor is renting an operating room from one of the hospitals and renting for you to stay there, and then also paying for your hotel and those kind of things. So it's all this package price. With Dr. Kelly, the quotes that I had to go to the Florence Hospital, the hospital that I did choose, it was $5,200. Now, if I wanted less rate, I could have paid $4,800, $400 difference, and gone down to the MI hospital. That would have been the lowest of the hospital. But if I wanted to upgrade and go to that brand new hospital, it would have been a little over $6,000, $800 or more to go to that newer hospital. So all these doctors that you're reading about and things like that, the easiest way to make a decision on weight loss surgery is first choose the hospital. Choose if you're going to go to the Florence or the Oasis, and maybe I steer you a little bit away from the MI hospital. And then once you're there, you can choose from a lot of doctors that operate out of there. So maybe choose hospital first, then doctor. 2 hotels that most of the doctors down there are using is after your surgery, you'll stay in the hospital for a night or 2, and then after that you're going to head over to a hotel. Most doctors are choosing to use the Marriott Hotel, and the Marriott Hotel is a good, clean hotel, but it is just your general run-of-the-mill hotel. There's a second one that very few doctors use, but that is the Grand Hotel. Now, the Grand Hotel would be a lot like staying at something like a Ritz-Carlton. It is your 4- and 5-star hotel, water fountains, pools, things like that. But most importantly, too, is they are very used to the weight loss surgery people, so they have a restaurant on premises that brings you up free broth as much as you would like, whenever you like it, room service right to the room. So if your doctor uses that, it's a definite bonus to go to the Grand Hotel. Let's talk also about coordinators, which are like the doctor's assistants that coordinate all their surgeries. And then also about these websites that host that they will get you set up and they got the cheapest weight loss and all these things. Basically, when I asked the doctors about them and I asked the coordinators about them, the websites just charge a fee in order to send the referrals to the different doctors and the different hospitals. But if you're lucky enough to find a phone number directly to a coordinator of the doctor you want to use, do it that way, because it will actually save you a few dollars if your doctor is willing to knock that off. But also you get better answers because it's that particular doctor and it's the coordinator who talks directly to the doctor, and that's the one you're getting your information from. Everything goes a little bit smoother. I wanted to put in a quick plug too for Dr. Kelly. A lot of people, if you ask them about their doctor, they become very defensive. Everyone wants to defend their doctor. They say, my doctor is the best. And if you read on the forums, they say, this doctor is the best. And I agree. All the doctors down there, your odds are you're going to find a great doctor and you're going to be very happy with them. I think Dr. Kelly did a few things that really impressed me, and I thought I'd mention about them, that go above and beyond what other doctors did. I talked to other patients and they didn't say anything about their doctor doing these other things. Dr. Kelly visited us many times in the hospital, but also in the hotel. He drove over and met us 2 or 3 times, and one time sat down and had breakfast with us there in the hotel. And I thought that was just a very nice touch. You can tell that Dr. Kelly genuinely cares about the patients that are in there. Even small things that you wouldn't think that you'd care about, but after the surgery and you go over for your bariatric test and you do your swallow test, before getting to the hospital over there, they pull in and they got you a Powerade because they said that the drink that you're going to drink is kind of a nasty taste in it. So that was just an extra special thing that they did for us there too. And remember, you're paying a package price for your surgery, and so a lot of doctors choose to put you over at the Marriott Hotel, which is a good hotel, but it's not like the Grand Hotel. And Dr. Kelly chooses to put his patients over at the Grand Hotel, even though it costs him more. His cost is right in line with everyone else, and yet you get a little extra special treatment. So real quick, I wanted to mention pain management while I was down there. While I was down there, I took some time to just talk to a bunch of the other patients that were there. They were with different doctors and things like that to find out how their surgeries went and all those things. Here's the good news. I can tell you that most people experience very little pain coming out of the surgery. It's not too bad, and after surgery, you're given a shot, and that can suffice for most people. I did have a bad experience though. For some reason, my surgery was very painful. When I came out of surgery, it was 24 hours and probably the hardest 24 hours of my life. And during that time, I learned a few things about Mexico pain management. And here's the major difference that you need to understand in Mexico. Here in the US, if you have a splinter in your finger, you can get narcotics for that. We really don't believe in pain at all, and we do everything we can to stay out of it. In Mexico, you actually have to lose that same finger in order to get any type of narcotics and things like that. I talked to some of the doctors down there and Dr. Kelly afterwards and just kind of asked about how that pain management was set up. And they really just don't do a whole lot with narcotics, and it's pretty rare that they do. So here's what actually happens. When people come out of surgery, for the weight loss surgery, you're actually given what's called an NSAID, N-S-I-D. The NSAID is nothing more than like a glorified ibuprofen. It's a liquid form of ibuprofen, and it would be just a step above prescription drugs, a step over the counter drugs. It would be a prescription form of ibuprofen, Tylenol, things like that. It's in liquid form, and so it does help, but it definitely does not help like the narcotics do in the US. And one of the other reasons to this, though, is remember, you're a prepayment thing too. Narcotics for pain management are much more expensive. And so I don't want to say that your doctor will choose not to give you narcotics because you didn't pay for them, but it does probably factor in that your package price does not normally include the narcotics. Now, if you ask this question to your doctor before going, or the coordinator that you're talking to and things like that, they're going to say, oh, yes, it does include it. We'd definitely give it to you. But you really want to ask deep about this question, because what I did find out is, yes, everyone is given one shot of narcotics when you leave the operating table and you're being wheeled back. But when that wears off, a second round or anything like that is not something that's in there. Here's my recommendation to you. Save yourself some time and hassle. Bring it up ahead of time and offer an additional cost to have the narcotics. Because what if each shot of narcotics is costing you an extra $100? Well, if you need it, and in that moment, you may want to just pay the extra $100 and know that you're going to have more of like a US type pain management than have to go through what I went through, and where you just have Tylenol and the ibuprofens to get you through. Last thing that I want to talk about is lightweights, I guess is kind of the term for them on the forums. If you've been reading through the forums and things, you'll read about people that have less than 100 pounds to lose. My heart goes out to anyone that's considering weight loss surgery. I did have less than 100 pounds to lose, and even that was hard on me. And so if you have more than that, I just say God bless you, and I hope that this goes very well for you, and I encourage you to do so. From today's date, I went into surgery 4 months ago. I went into surgery at 230 pounds. I am 5'10" in height, and today now I have lost 55 pounds and I'm down to 175. So I mentioned this to lightweights. I wrestled with whether I was overweight enough to have the surgery, but after having it, I am fantastically happy that I did. It was one of the best decisions of my life, and it feels good now to be back at that normal weight. And like the statistics kind of say that once you're more than a 30% BMI, that you have less than an 80% chance of ever reaching a normal weight and being able to maintain it. And I'd spent so many years dieting and this and that, and I may not be considered super overweight, but I definitely was overweight. It definitely affected my life. And being now at 175, it is a small price to pay to have this surgery and not have to worry about that anymore. So if you are a lightweight and you're considering it, I want to tell you it went well for me. I still encourage it, and I'm very happy. So I also thought I would show you a quick before and after shot. Here is before the surgery, 230 pounds at 5'10". And now here is the after. In the after shot, I'll show you also then the scars and things like that. So this is only 4 months now after the surgery. And everything has gone very well. These will be your little reminders that you get. You get 5 little incisions. But other than that, it is a small price to pay. Today I'm wearing 32 jeans, and this is a medium shirt. I have not worn a medium shirt since high school. I was extra large shirts before that, and I started at size 38 pants, and even those were getting quite tight. So, God bless. I hope things go well for you.